You're most welcome to today's talk. It's May Day, so happy May Day, and it's a Saturday the 1st of May. Some news from around the world. Basically, English-speaking countries, things are looking better, but there's calamities unfolding in Asia, which we'll be looking at. Now, let's start off with the English-speaking countries here. These are the trends, so Australia, New Zealand, obviously. Hope you got the chance to listen to Dr. Farrier yesterday. The talk with Nigel was very interesting on Australia. Then we've got the United Kingdom, which is just drifting down ever so slowly, or is that flat, almost flat, drifting down very slowly. Ireland, a little more turbulent, I'm afraid. The vaccinations in Ireland, of course, aren't what they are in the United Kingdom. United States, definite downward trend. Now, this is very encouraging. Let's just hope the vaccination programme really goes ahead apace in the United States. And Canada, well, Canada's the highest of the English-speaking countries, unfortunately, at the moment. Now, starting off with some news from the UK, first of all. Now, the UK is awaiting changes for 2 doses, people that have had 2 doses of the vaccine. Now, in the United States, the guidelines have already changed so that people that have had 2 vaccine doses can behave differently. Mixing in households indoors, for example. In the UK, that has not changed. So as of now, the rules state that people who have had 2 vaccines behave exactly the same as people who have had no vaccines. So stark difference here between the approach in the United States, where people with 2 vaccines are allowed more liberties, where in the UK they're not. Interesting difference. The sociologists among you may care to comment on that. Somewhat outside my area of expertise. But so indoor gatherings are going to be allowed in the UK. Wales the 3rd of May, England the 17th of May, Scotland the 17th of May, and Northern Ireland the 24th of May. But unlike the United States, this is not going to be stipulated as conditional. This is going to be for everyone, regardless of their vaccine choices or vaccine status. So quite an interesting difference of approach on both sides of the Atlantic Ocean there. Professor Jonathan Van-Tam, if two people who both had 2 doses of vaccines and have both served at least 14 days after their second dose, that's a good point, at least 14 days after the second dose, then I would be highly confident scientifically, he puts this in funny language, but you can see what he's getting at, scientifically, that if there were reputable vaccines, then indeed it would be incredibly safe for those 2 people to meet, incredibly safe. So this is the Deputy Chief Medical Officer, very well thought of in the UK, unlike some other doctors who aren't quite so well thought of. And he's saying, well, if you've had 2 vaccines, then it's going to be scientifically incredibly safe. But is that going to be reflected in national guidelines as it is in the United States? I strongly think it should. You may disagree, but the United States has gone one way and the United Kingdom's going another way. So, interesting difference. Paul Hunter, Professor of Medicine, University of East Anglia, he says this is true. He agrees with Professor Van-Tam if we're talking about the B117, which is the most prevalent strain in the United Kingdom at the moment. But what he's worried about, and what I'm worried about, is other variants arriving in the UK, which of course could happen. This issue is variants with escape mutations are less affected by the vaccine is the issue. So probably, well, we believe, well, we know with the Oxford AstraZeneca vaccine that the data in India is showing that people who have had the vaccine are not getting very sick or being hospitalised or dying, or they are, but minuscule amount, absolutely massively protective against severe illness, massively protected. But for the Pfizer, actually, we don't have the data on the India variant. As far as I'm aware at the moment, we're awaiting that. So basically, there's still unknowns, I think, is what we're saying. So the issue is that the variants with escape mutants, so that's a little bit of a question mark there. And we haven't come to a clear understanding of what those risks are, which are clearly so. Now, as of the 22nd of April, the COVID Symptom Tracker app, Tim Spector Group, said that the UK, India or South Africa variants have yet to make an impact on the UK. Now, hopefully they're not going to. But we have seen the effect that new variants have made before. But let's hope that we're not going to get an increase in cases in the UK because of our very liberal allowances of people flying in from India, only recently restricted. More on that in a minute, actually. But let's look at India itself first of all. Well, new daily cases in India. Well, look, I mean, this graph speaks for itself, doesn't it? It is going up continuously, rapidly. And again, I was saying this back from about here. It's hard to see quite what's going to stop this at the moment. And of course, this line here, which we can't see there, but that line there is that's 300,000 cases. That's 400,000 cases there. So that's the 300,000 cases mark, which has been broken through. That's the 400,000 cases a day, which has just been broken through now. And these are just officially diagnosed cases, of course. And we know that India has got really quite limited testing. Now, the United States has sent quite a lot of additional tests to India, so this should help with understanding the true position, but still limited testing in India. So therefore, we know these are massive underestimates. So over 400,000 new cases in, that was on Friday. That was Friday. So over 400,000 cases on Friday. Well over 19 million officially diagnosed. Deaths carrying on and increasing. But again, we know these are greatly underrepresented. Vaccines in India, not great. I mean, well, it sounds good. All adults are now eligible for vaccine in India. If there was any, but there's not. It was the over 45s. One dose, 10% of the population. Two doses, 1.5% of the population. So quite why the Indian authorities are saying that everyone now is eligible for vaccination over the age of 18 when they haven't got enough for even the over 45s is a bit bemusing. And it's sad to see that there are a lot of politics coming into play in India. People who haven't got oxygen aren't allowed to say they haven't got oxygen sometimes in some states because that's disinformation. I mean, we're into a nonsense situation here, and it's become some aspects of the Indian management of the pandemic have become totalitarian, and this is a big political issue. Meanwhile, the people suffer, of course, and the poorer the people are, the more likely they are to suffer. Corruption is rampant, of course, in India. People being sold gases that aren't oxygen, people being sold bogus drugs, people paying for tests to get into hospital, but then they don't get in. It's so sad. You've got such heroism in some aspects of Indian society and individuals, and you've got such despicable behaviour in others as well. It really is sad to see the good people suffering because of the actions of corrupt individuals. India, Australia. Now there was an Indian cricketer, I think it was, and he went. He wanted to go back to. It was an Australian cricketer working in India, and apparently a lot of Australian cricketers play cricket in India, and he wanted to go back to Australia, obviously. And he went via somewhere in the Middle East and then ended up in Australia. That's now a criminal offence. If you are in India now and you work your way back to Australia, it's the 5-year prison sentence in Australia. Completely draconian regulations, but of course this will protect the entire population of Australia. So from Monday, it's a criminal offence for citizens to return home. So this is Australian citizens from India are not allowed to go from India back to Australia. Whereas in this country, we had Indian people people living in England, Indian people living in England, probably with dual citizenship or something, flying to India for a wedding, then flying back. You know, the liberalisation that we had that has given this virus, these variants, the opportunity. Same in the United States. There's still flights going. I mean, I think there is going to be restrictions next week on flights from. In fact, I've got it here. We'll do that in a minute. 4th of May it is. But the opportunity that we have given for this variant to spread around the world is just despicable. It's almost as if we've been let down by our politicians again. So, criminal offence. So the Australians have taken steps to protect the population of Australia. India, United States. So there's restrictions from the 4th of May. Most non-US citizens who've been to India within the last 14 days will not be allowed into the US. Now, reading between the lines there, that means that people with dual citizenship, India and the United States, will be allowed in. Some of them will carry this mutant, I would strongly suspect, wouldn't you? So, stark difference in approach between the Australian authorities and the United States authorities. And who knows what would happen here if the Indian variant did become loose in the United States? We simply don't know. And I, for one, would be quite content not to find out. And I'm sure if you're in the United States, you'd be quite content not to find out. But it looks like you might be finding out. So radically different approaches. Australia, I think I see protecting its citizens. United States is going to allow dual citizens back in to the United States. There you go. India and France. First cases of the India mutant detected in France in the southwest. A patient who are currently hospitalised in Bordeaux. 2 more cases in the southeast in this area, this department of Marseille. 2 more cases. And these were 2 people returning from India without any link to one another. Because the virus is so prevalent in India, this has got to be a significant risk. So they weren't epidemiologically linked. So just another example of flying around the world causing problems, as we talked about in January 2020. Tempted to say I told you so, but I won't. Well, I've said it now, haven't I? But, why on earth didn't the World Health Organization advise stopping flights in January, February 2020? Then we wouldn't have had a pandemic. I could see it from sitting in here just looking at public domain data, but they couldn't. It's just, I feel badly let down, really badly let down, and all the people that have suffered. So the people that are suffering in India now, if this pandemic had been truncated in January 2020, they wouldn't be suffering now. Gets you a bit angry sometimes. France also have a 10-day quarantine for arrivals from India, Brazil, South America, Chile and Argentina. Let's hope that's enough. Should be, depending on the capacity. Part of the reason the Australians have said that you can't come if you're an Australian citizen, you can't go from India to Australia is they don't have the hotel quarantine capacity. It's a capacity issue. Because return to Australia has always been restricted anyway, even for Australian citizens. Now, talking about the India situation, the sequencing rates, how do we know what is where? Well, the answer is, one heck of a lot of the time, we don't. We don't. If you're in Iceland, you've a pretty good idea. So Iceland is sequencing 78.8% of positive samples, which of course is very good. Australia 60.3%. But of course these are based on smaller numbers, so it's more manageable. Likewise for New Zealand. Given the number of positive cases in New Zealand, the fact that they're only sequencing just less than half of their positive cases is pathetic. So they got across. They should be doing much better than that in New Zealand. Denmark, it's excellent, 20%. Taiwan, 16%. UK, 8.7%, which is good. This is over about the past 6 months, I think. Norway 5.6, Vietnam 5.5, Vietnam leading the United States by a long way, the United States 1%. Very poor for the United States. The Vietnam situation with a lot of extreme poverty and difficulties and, well, many difficulties, over 5 times the sequencing rate of the United States. India, it's 0 point, it's virtually nothing. It's 0.06%. Very, very low sequencing rate. So out of 18 million cases, They've sequenced 10,626 sequences. So very, very low. Now, I've written 102 there, and I can't remember what it's for. It'll come to me later. Anyway, out of 18 million cases, 10,500 sequenced. In other words, what's going on in terms of the variants in India? Well, it's hard to tell. I mean, the initial information was saying that the India mutant is quite prevalent in Maharashtra, the Mumbai area, and the UK variant is more prevalent in the New Delhi, north of India area. But given that amount of sequencing, you can probably make something up that's equally accurate. It's a very crude indicators. Now, also on the India situation, US government's just sent $100 million worth of supplies, encouraging to see. US State Department citizens should leave as soon as it is safe to do so. So the US State Department is advising American citizens to leave ASAP. The Australian authorities are saying you can leave, but you can't come back in Australia. Which country is more likely to be exposed to the India variant? Pretty obvious. Spread to small cities and towns. Now, my friends in India were saying just last week that most of the cases in India are in the cities. And when it spreads to the small towns and villages, it's going to be more devastating because they simply have virtually no medical facilities in many parts of rural India. So that is going to be an issue. And there isn't. I mean, I've worked in Indian villages and there's no one there. I mean, I've been peripherally involved in training up some like healthcare workers from Indian villages, and these are basically they're not doctors or nurses or professionals of any sort. They're just people who want to help their community, and we could give them some basic education. But it was pretty basic stuff. Health promotion rather than medical treatment. So many people that get sick in Indian villages are probably never going to see a nurse or a doctor. Is the sad reality of the situation. So this is happening now. Spread now occurring, underreported. Corruption and black markets are going on in India, alongside extreme nobility. It has to be said. The two are side by side in India, and it often is thus, unfortunately. Medical debt is a huge problem in India, and it's only going to be getting worse. And remdesivir is very, very, very highly thought of in India. So I was talking to an Indian doctor friend yesterday, and he said if you don't give remdesivir, which is remarkably expensive, even in India it's expensive, and the patient dies, then the relatives blame the doctor for letting the patient die because the doctor didn't give remdesivir. So the doctors are more or less obliged to give remdesivir when they can, because otherwise they get blamed if the patient does die. And unfortunately, patients are dying quite frequently from other causes, mostly simple lack of oxygen, of course, and other basic drugs like dexamethasone, which are very simple drugs to give. Adjacent countries, Pakistan. Well, trend increasing there. It looks like it's going down a bit, but there are worrying noises coming out of Pakistan. So quite what is happening there, hard to say. Nepal, but certainly worrying. I would suspect, I think I'd put it stronger than that. I think it's inevitable the India variant's going to go through Pakistan in a very similar way to India. And Nepal. Again, I've done a little bit of teaching in Nepal. New cases, beautiful country, lovely people, very, very poor. But the cases are going up now. So lower population, of course, that's the 6,000 mark per day. But as with India, in the last week or two, it's that direction that is concerning. And the health facilities in Nepal are perhaps, are worse equipped to cope with this influx of patients than they are in India. So really pretty ominous for that part of the world. And I believe things are difficult. I mean, I haven't checked it for the last couple of days, but Brazil and South America also difficult. So these countries at the moment are the more fortunate ones. But let's spare a thought for Asia, Brazil and Mexico at this time. Now I'm going to look at remdesivir now. So that's the news part over. We're going to look at remdesivir. Is this effective? Does it? I mean, it's so overhyped in India, really. And of course, there's other antiviral drugs, which are, if an antiviral drug is not in patent, then of course the pharmaceutical industry wouldn't make money by promoting it. But remdesivir is in patent, and it's phenomenally expensive in the States. I've checked the price in the UK. This is straight from the National Institute for Health and Care Excellence. Never liked that name. I don't mind the nice bit, but whenever you have to say your care is excellent, you know, that probably means you've got doubts about it. But there you go. Anyway, check it out for yourself. There's the reference. And here we have it, remdesivir. 1 vial, normally a 10-day course, of course. Indicative NHS price, and that's £340 per vial. If it's a 10-day course, well, you can work that out for yourself, can't you? And I believe it's even more expensive in the States. I don't know what the price is in India. It can't be this much because that's utterly unaffordable by most people in India, but that's the indicative UK price. But is it effective? So there is some good data on remdesivir for the treatment of COVID-19. Now, this final report came out on the New England Journal of Medicine, 5th of November 2020, because we always need to look back to the evidence to see if what's being done is evidence-based. So this was a good trial, randomised, placebo-controlled trial, intravenous. This is an intravenous drug, so it's fairly high-tech. You know, you need people that can put up intravenous lines. So you're talking about doctors, experienced nurses to do that. It's not a treatment that's probably going to happen in Indian villages very often. 10-day course typically. This trial was in patients hospitalised with COVID-19 who did have evidence of lower respiratory tract infection. So this was already poorly people. Now, of course, we know that this is a phased illness. So here's the graphic we've used for this quite a few times. I think that's from the East Virginia Medical School. So if the virus is only alive during this period of time, then that's the only time it's worth giving antivirals. We were talking to Dr. Corey a few days ago, and he was saying that doctors are faced with poorly patients because of immune dysregulation, and they're giving remdesivir, but the virus has already gone, so what's the point in that? And this viral debris is dead, because this is a phased illness. This is the time to give antivirals. So you'd have to give it early on in the disease process for it to have any benefit at all. But that was done mostly in this trial, so that's okay. They recruited 1,000 patients, 1,062. Remdesivir group, that's big enough. Placebo group, that's big enough. So there you go. You can compare the results between the two. So the remdesivir group, median recovery time 10 days. Need for oxygen, they needed it for 13 days. Mortality by day 15 was 6.7%. Mortality by day 29 was 11.4%. That was the remdesivir group. So that's the group that got it. Now, can we get both of those on at the same time? Maybe not. So this was the control group. Median recovery time was 15 days, as opposed to 10 days. So slightly quicker recovery time in the remdesivir group compared to the controls. Need for oxygen in the placebo group, the control group, 21 days. Need for oxygen in the remdesivir group, 13 days. And in the remdesivir group, less people needed to go onto oxygen in the first place. Mortality in the remdesivir group at day 15 was 6.7%. Mortality by day 15 in the placebo group was 11.9% for the placebo group. Mortality by day 29, 11.4% in the remdesivir group. Mortality by day 29 was 15.2% in the control group. So we see all these parameters are showing remdesivir does have some antiviral beneficial effect. Well, some beneficial effect. We can't say it's antiviral from this. So mortality by day 29 in the remdesivir group, 11.4%. Bear in mind these were people that were already poorly in hospital, versus 15.2% by day 29 in the control group. So Just to run through that again, 10 days in the remdesivir group, 15 days in the controls, in the placebo. So that's good. That's better for the remdesivir. Need for oxygen was 21 days in the controls. Mortality in the remdesivir mortality in the control group was 11.9%. That was it. 11.9. So 15, 21, 11.9, that's right. And the mortality by day 29 was 15.2%. So we see in every parameter there, the control group are not doing as well as the remdesivir group. But it's not massive. It's not massive. So the hazard, and it's very expensive. And the hazard ratio was 73%. So 73% less. So if you had the remdesivir, your chances of dying were 73% as opposed to 1 in the control group. In other words, that's the beneficial effect of 27%, isn't it? Is that right? 27%, yeah. So yes, there is a benefit, but this, of course, is in patients that are already hospitalised and already poorly, but it is very expensive. So from this, if I was hospitalised with COVID-19, already hospitalised and already, what was the criteria? Evidence of lower respiratory tract infection, then yes, clearly you would want this because it does have some efficacy. But it is expensive and it is intravenous. And it has to be given at the right period of time. And other therapeutics are not regularly considered, which is unfortunate. So there you go. There is some benefit, but it is very expensive, and it's all over. It's all over in Indian social media. Serious adverse events: remdesivir group 24%, placebo group 31%. So again, we see less serious adverse events in the remdesivir group. So that is showing that level of efficacy, hazard ratio of 73, 0.73. So there we go. Bit of what's going on and a bit of science today. No idea how long that went on for. But if you're still with us, then of course, thank you for watching.